When approaching any casualty, you should perform a primary survey following the Dr. ABC framework, first assessing if it is safe for you to approach them, then checking their response. If the person is unresponsive, shout for help, open their airway, and assess their breathing for 10 seconds by following the listen, look, and feel guidance. If a casualty is unresponsive and not breathing normally, you will need to both start CPR and call the emergency services immediately. Adult CPR consists of two parts and should be completed at a ratio of 30 to 2, 30 chest compressions followed by 2 rescue breaths. The first part of the CPR process is chest compressions. These are most effective when performed on a hard surface like the floor or a table. They should be performed as follows. Kneel close to the casualty to their side. Place the heel of one of your hands in the middle of their chest and place your other hand on top of the first hand, interlocking your fingers if possible. Lean forward so your shoulders are over your hands, keeping your arms straight. Push down hard with both hands, pushing the casualty's chest inwards about 5 to 6 centimeters, and then release the pressure, allowing the chest to expand. Repeat this 30 times at a rate of 100 to 120 pushes per minute. You should only perform rescue breaths on an adult during CPR if you have received formal, in-person first aid training. If this is not the case, give continuous chest compressions. After performing 30 chest compressions, and if you are comfortable and trained to do so, you should perform 2 rescue breaths. If a CPR face shield is immediately available, then this should be used when performing rescue breaths. However, if you are alone, you should not interrupt CPR to retrieve a face shield. Rescue breaths should be performed as follows. Tilt the casualty's head back, lifting their chin and opening their mouth. Pinch the soft part of their nose so it is closed. Breathe in, place your mouth around the casualty's mouth, creating a seal, and breathe out, blowing steadily and firmly into the casualty's mouth for up to 1 second until their chest rises. Remove your mouth and allow the chest to fall. Then repeat this process once more to equal 2 rescue breaths. You should then continue with 30 more chest compressions. It is essential that chest compressions are not interrupted for too long, so you should only ever perform 2 rescue breath attempts. This is regardless of whether or not the attempts are successful. Remember, if you are not trained or comfortable to complete rescue breaths, you should instead complete continuous chest compressions.